Hi, everybody. Thank you. I'm Brenda Green with the Be Strong Group, the founder and CEO of the Be Strong Group, a nonprofit for sickle cell awareness that my husband and I founded in honor of our son, Braden, who has sickle cell disease. And thank you for joining us again for another Tuesday chat. And we all should have heard by now that May is being recognized as Mental Health Awareness Month. And that is such a vital topic to discuss, especially for those of us with children with chronic illnesses. So I am so pleased to have a guest who can talk to us more and answer some questions that we have when it comes to mental health and our children with sickle cell disease. So I am so pleased to welcome Dr. Jeff Schatz. He's a clinical psychologist that has worked with children with sickle cell disease and their families for about 30 years. And he works at our local children's hospital, Prisma Health Children's Hospital, Midlands. He works with our children, our sickle cell disease patients here in Columbia. So we're so excited to have Dr. Jeff. And I'm going to let him introduce himself and share more about him and what he's doing for our children here at Prisma Health Children's Hospital, Midlands. Hi, Dr. Jeff.
Hi, thank you, Brenda. Thanks for having me here. Well, some of you may have come to the sickle cell clinic there at Prisma Health, but you may never have seen me because I am a psychologist. I started working with kids with sickle cell disease in 1992 in St. Louis at St. Louis Children's Hospital with the help of a excellent hematologist by the name of Dr. Michael DeBon, who helped me get started in the area of sickle cell disease. And but now a lot of the work that I do is more teaching and training and program development. So I do enjoy getting to work directly with patients and their families sometimes, but a lot of what I'm doing, I have two excellent people. I know, Brenda, you know Sarah Bills and Julia Johnston that are master's level clinicians, and they're working on their doctorate, and they're came specifically to learn how to work with kids with sickle cell disease as a psychologist. So a lot of what I do there is help them. They do the frontline work. I'm in the back figuring out what we should be doing, how we should be doing it, helping to teach them. And so, again, just for those of you that have gone to the clinic for care, I'm there, but I'm probably back somewhere hidden. And after they go out front and help people, they come back, and I'm kind of their coach to help guide them through the process. So we have a lot of programs that we've developed there over the years. I think we've actually done a lot of new initiatives over the last year. They've restructured some of the sickle cell care. So we're even more involved than ever. We're doing a lot more just routine check-ins with people. We're doing a lot more work with people on the inpatient unit when they're having really significant pain episodes. We're doing a lot of new things to try to be engaged with pain management. We've historically had a lot of involvement in working with kids with school difficulties and maybe some kinds of neurocognitive difficulties from sickle cell disease, but we're really doing much more than that now.
Okay. Thank you, Dr. Jeff. Just so you know, we appreciate you behind the scenes and all that you do for our children. And I know I described this past year, as COVID-19 times. And a lot of times, within the community, there's so many different stigmas associated when you seek mental health services. Maybe there's some pride, maybe there's some embarrassment, or just don't know that that's what you need. And so I think it's so very important, especially being a parent with a chronic illness, when there's so much they have to deal with before COVID, without COVID being involved. But this moment of being quarantined or wearing masks or, being socially distanced from friends, being virtual school, it's a lot. It's a lot on our children. So this discussion is so necessary. And I know I've said in other Tuesday chats is with the child with sickle cell disease, we have to make sure we treat the whole child. Not just the pain, the whole child. So this is an important piece of the overall puzzle that we need to address. So Thanks again, Dr. Jeff. And I did receive some questions in advance. I don't know if you wanted to respond to what I just said, but I did have some questions if you didn't mind answering.
Yeah, you can launch into the questions. I'll just say, I mean, I think one of the biggest things when I teach people about mental health, which is one of the things I do at the undergraduate level at USC, one of the big things we cover is mental health stigma. It has a huge impact on people's well-being just because there's a whole bunch of historical reasons why that stigma is there, but it's one of the big things that interferes with people getting the help that they need. And I think, it's easy to always focus potentially on the negatives, but I think there has been a big movement over the last 20 years where a lot of people, particularly younger generations, are feeling less stigma about mental health, a lot more people willing to reach out and try to do something about it. And so that's something I'm very interested in addressing. I think one of the things is just to demystify it. A lot of times people think psychologists are doing tricky, magical kinds of guru things, when in reality, a lot of the things we're doing are pretty straightforward. They're just things that we've learned through careful study about what works to get people where they want to be. And so that's important to me, is to kind of demystify it and have it be a straightforward thing where people can get help without feeling like they're being judged or thought of in a negative way.
Absolutely. I'm glad you mentioned that, because there's so much misinformation, and I'm sure we'll find through our conversation today that it doesn't always require medication. And there are so many different things. So just to start out, how does sickle cell disease impact a child's mental health?
Well, there's a bunch of different things we could talk about. I think one of the things that people may not recognize, because it's not completely worked out in the literature, but it's something that I've seen several studies talk about, is just, for starters, the physical effects of the disease. There have been a couple of different studies that I've seen that I thought were pretty elegant that showed that the more severe sickle cell is, the more susceptible people are to stress. So whenever we're stressed, we all have a physical reaction to that. It changes us mentally, physically when we're under stress. And the more severe sickle cell disease is, the more stress reactivity we have. And it doesn't matter the source of the stress. It could be a physical stressor, an emotional stressor, a cognitive stressor. But the more severe the disease is, the more stress reactivity people have. And stress reactivity is good for some things, like if you need to muster your strength to fight off a bear or something. But stress reactivity doesn't help us with most of the modern problem solving we need to do. And so that kind of, it doesn't doom people, but it means there's a higher level of challenge there. They have to have a higher skill level to manage things right off the bat because of that aspect. And then the second thing, really, which a lot of you probably understand even better than I do, is just all the little accumulated extra stressors that other kids don't have to deal with. So there's, lots of the myth that childhood is a happy-go-lucky time is something we all need to set aside. There's lots of stressors just with being a child in the world. And then on top of it, with sickle cell disease, you have, recurrent pain episodes that are unpredictable and vary. The unpredictability of your health can be problematic for feeling like you can make plans and just kind of know what your future might look like. And then just kind of that accumulation of those different stressors that push people towards some things that very naturally happen with those stressors, but they're things we have to learn to counter. So it's very easy when we encounter lots of different stressors, lots of different problems with our health, to kind of want to curl up in a ball and not do things. And there's times where people have to do what does not feel natural, which is to kind of push through some of those things and get out of their shell and do things even though it doesn't feel like the right thing to do.
Okay. So how can a parent or caregiver identify if their child needs help mentally in coping with their illness? What are some signs they can look out for?
Well, I think one of the things that's very important that we have been focusing a lot of attention on, particularly with teaching people about pain management, is there's this fine line between the fact that the child may feel pain, fatigue, and have other kinds of difficulties like that, which requires some changes to expectations of them, but to do that in a way where the child is not developing a sense where their identity and their sense of self revolves around being sick and being ill and being in pain. And that's one of the pathways that people can kind of go down. It's very understandable as a parent that if your child's in distress and hurting, not feeling well, you want to protect them. But if that goes too far, kids kind of adopt that as their role in the world. And that's actually kind of one of the more important things that we look for early on for something where, you know, is the child still doing what they can to do things that are fun, activities they enjoy? Are they able to tough it out and, you know, try to go to school even though they're not feeling their best? That kind of persistence and effort in life is kind of what we need all kids to be doing. And there's extra challenges for that in sickle cell disease. But I think that's the main thing that we look at is when kids are getting into a mode where they're too passive and not showing the kind of energy and initiative where they're doing things that they enjoy in life. They're working at things that are maybe hard for them to do, that kind of thing.
Oh, wow. That's that sense of self, not losing that. That's important. That is a excellent point. Well, what are some ways to ensure that we can ensure that our children's mental health remains healthy? Can you identify some preventative measures that caregivers can take?
Well, there's a whole range of different things. I think one of the things that's sometimes overlooked is that if you want to, like as a clinician, if I want to take care of the kids and help them to do better, the first thing you have to do often is help the parents to function better. I mean, a lot of the parents are under a lot of stress, a lot of strain, managing all the adult roles that they have, raising children. And for the most part, children learn a lot of their coping behaviors, not by what we say, but by what we do as parents. And so the things that parents say, the things that parents do end up having a big influence on the kids. And so it's kind of looking at that interaction between the two. You know, if the parent doesn't know how to engage in self-care, it's hard for the child to learn those skills. If the parent isn't able to find sources of hope, sources of optimism about the world, it's going to be hard to just coach your kid to be that way when they face challenges. And so I think we really, you know, to me, you know, we want to be careful because psychologists sometimes can come across as if we're blaming parents for things. We're not trying to blame them for things, but trying to help them to understand that health is a tricky thing to figure out in terms of a lot of the health habits that we need to have. And so there's basic health habits about, you know, we all need a certain amount of sleep. We all need to eat a certain amount of like healthy foods every day. We need kind of a day where we're engaged in some kind of meaningful, fun activities on a regular basis. Those kind of things we think of as psychologists, we think of those as like healthy patterns. Am I doing something that's mentally engaging every day, physically engaging every day? And when we take those things away from our life, we suffer. And so I think a lot of times, again, it helps as much as parents can to figure out how to do those things for themselves and model those things for their children. And sometimes if you can't do that for yourself, you have to fake it and get the kid to do what's healthy anyway. I know as a parent that would happen sometimes where I didn't have the resources to do all the things for myself that I should be doing, but I could at least fake it when they were younger. And maybe could be, but again, helping them to be regulated in terms of kids do better if they're have a regular sleep pattern, regular, you know, patterns for eating healthy foods. Like I said, being physically, mentally active, all those kinds of things are helpful, along with some of the things that I was talking about before. I think people need to have reasons to be hopeful about the future. People need to talk about that among people in their family. And I think the other thing that's really potent as a psychologist, I would say, is even though life is tough and a lot of difficult things can happen, people who spend regularly spend time reflecting on the things in their life that they're thankful for, that's a huge thing in terms of people's mental well-being. A lot of people, again, spend a lot of time suffering because they spend so much time worrying and thinking about their problems that they don't spend time thinking and appreciating the things that they value and have in their life. And I see the question about exercise. Exercise is another excellent thing. A lot of the focus on the health benefits from exercise now is that you can do traditional exercise that's more intensive if that's what works for you. But even what they call moderate intensity physical activity can be very beneficial to your mental health. So it doesn't have to be sprinting around and lifting heavy weights and doing things like that in a gym. It can really be whatever you like to do that's active, walking, gardening, whatever that thing is where you get up and move around. I think a lot of the things around health and physical activity are about spending as much time as you can during the day not sitting, as opposed to focusing on, like, running, jogging, that sort of thing. Although if you love that, that's great, but it doesn't have to look like that. And again, there's other kinds of health things that can be very helpful. The things I was talking about around thankfulness have to do a lot with the idea of mindfulness, which people can get at through different ways. People can get at that through prayer and meditation. Some people like yoga. There's all kinds of different things, but having time on a regular basis to do something that's relaxing to you, even if you can only find 20 minutes a day for it, can make a huge difference in people's health. And that doesn't matter if you're 7 or 70. It has health benefits.
Okay. Some valuable information you're sharing, Dr. Jeff, and especially for parents. We have to look at this as a family thing or caregiver. It shows how we impact our child's ability to cope. So we need to pay attention to ourselves and not be afraid to allow ourselves to seek help or services. I know with our nonprofit, we try to do support groups too with the moms and adult sickle cell warriors. So I think that's a good outlet as well.
I saw a question in there about whether or not kids may outgrow their problems without help. And I think the answer is maybe. Often people do. There are people who find their own way through without professional help. And so I would be lying to you if I tried to say like everybody has to go see a professional to find their way through. But I think that, I think it's like a lot of other health things. There's things that we know that tend to work, are more likely to work than other things. When I tell people about psychology, one of the things I tell people is that I don't know exactly what's going to work, but I know from what we learn from research is what is most likely to work and what's second most likely to work in general. And so I think, again, just for me, given that I am somebody that thinks that kind of research work is helpful, is it just says like, well, if you're going to try something, like here are the things that we think are most likely to work. And so I think that can be helpful. The thing that I think may be relevant to that question, though, is that one of the things I try to emphasize is that there are times where we recommend people go to like formal psychotherapy or counseling kinds of things. But I think there's a whole range of things people can do. That's a very formal, more intensive way of getting help. But there should be a whole range of different ways that we can give people information about how to help cope with different kinds of things that they're dealing with. And certainly, I think it's like anything else. If your child had an infection, you could sit back and much of the time their body might heal it themselves. But your chances are maybe better of having a good outcome if you go see a doctor and they make some recommendations. Is this an infection that we should treat with antibiotics, or is it good to let it go the way it is? And so I think I would use that analogy that sometimes people recover faster if they get some professional input, and maybe there's less suffering before they turn things around if they can get some professional input. So it's not always just whether it's going to be a permanent problem, but kind of what's the humane thing to do to help people get through the struggle they're having.
Okay. And perhaps I see another question that popped up. Are there any online resources available?
Well, there's loads of stuff out there, that we have no shortage of information these days. The challenge is figuring out what's the good information and what's just somebody's half-baked opinion that they've decided to state with a lot of confidence. So there are online resources out there, and I think that's a really good thing for us to look at. I know in the hospital we try to organize specific online resources for specific questions that we tend to get there. But it would be helpful if people want online resources for me to know kind of more specifically what topics they'd be most interested in. That's one of the things we love to do there, is to organize information for people so that if they can access resources in ways short of saying like, well, you need to come in and see a professional psychotherapist or something on a weekly basis. We think there's a whole range of different ways of getting the information that people might want.
Okay. And I know that's a good question, because just being following different groups, sickle cell groups on social media, I know everybody doesn't have the resource that we may have at our children's hospital with you and your group. So there are a lot of people out there looking for information and support.
Yeah, okay. So I was born and raised in the Midwest in a farming community where we were taught not to ever brag. That was kind of one of the worst sins you could commit. But yeah, we actually do hear. I know people all over the country that work in sickle cell clinics, and I know there are gaps in things we could do better here. But we have much more in the way of psychology resources than they have in some of the hallowed halls of children's hospitals around the country, including a lot of places that have even bigger sickle cell programs. But I know when I first started in this area, I went to the sickle cell meeting in Baltimore the first year and spent the whole meeting. One of the things I did was wander around trying to find another psychologist, and I couldn't find one. There might have been some there, but I just couldn't find them. And so it's hard to find psychologists that devote all of their time to sickle cell disease. And so that's one of the unique things that I think I've been able to develop here, is to have more like a full-time focus on sickle cell disease and figuring out how to have comparable services for kids with sickle cell disease as we have for some of the other medical conditions. It's just, it's the reality of the world that there's a lot of interest in cancer care. And most places you go around the country, they have a lot more private donations and private support for cancer care. And that's how a lot of the psychosocial services get paid for. And so one of the things we're fortunate here is that the Camp Chemo programs about a decade ago decided that they were going to not just do cancer, and they were going to do blood disorders as well. And I see Vernon on there. Yeah, Emory is one of the places that does have better psychology support. So I'm not saying we're the only one around, but I've been kind of surprised when I've talked with people other places that they have psychology kind of, sort of, but it's not really integrated in the clinic the way that we do it. Again, we've set a goal of having people doing annual screen. We do an annual check-in with everybody every year, just regardless of what's happening. Just we want to check in and get to know the families better. It's a little bit tricky because we have about 525 kids now, which is a lot of people to keep on top of. So we don't get to do it quite the way we'd like to, but we do some brief things to do some check-ins with people and to see how people are doing. If they have any behavioral or mental or social health needs that we think we can address. And I think that's an important part of just having that check-in, so that we can hopefully identify and work with people when things are only a little bit of an issue, instead of waiting until things are really a mess.
Absolutely. And that's important too, to kind of be proactive whenever we can, because we know things will pop up. So, but I think you may have answered this one, or kind of, sort of, but there's a question we received. what age should parents, caregivers begin talking to their child about how they're feeling inside? And I know you mentioned about kids watch us. So, and I know little kids, they watch and record everything we
Yeah.
do. So,
Yeah, I mean, that's one of the classic things that we teach people about pain management. If you look at a little toddler will toddle around, and when they fall down, the first thing they'll do is look up at the adults around them to figure out what to do. And if the adults look scared and frightened, then they start crying. And if the adults have a smile on their face, they kind of laugh and get up and keep walking. So they're at a very early age, the kids are looking for cues from us as to what emotions they should have in different situations. And so that's an important thing that we model for them. It's a tricky thing because it depends on your natural way of being in the world. But if you're somebody who's prone to panic when things don't go right, you shouldn't be shocked when you discover that your kids panic when things don't go right for them. It's something that they pick up on. So it's hard to figure out, a lot of these things are subtle things, and what we'll see in our kids are our own kind of bad habits or weaknesses. And then it's extra frustrating if you realize that they learned it from you. I know that from my own kids.
okay.
But I think, it's actually very early on, we can learn to talk to people. Like, I think if you spend time reading children's books with kids, even at a very young age, getting to talk about the emotions that different characters are having in the books, I think when you see your kid feeling a particular way, being able to label that emotion for them, even when they don't quite have the ability to do it, can be helpful. So it can start very young, helping people to get in touch with how to put words to the kinds of things that they're feeling. And that's not a magic like panacea to be able to do that, but it really helps because, we do see a lot of people. Particularly, it happens more with the teenage boys probably than anybody, but it can happen to anyone where they just spend a lot of time bottling things up and not talking about what's going on with them. And people can only do that for so long. Sooner or later, if the stresses pile up, they kind of hit a breaking point. And not everybody's convinced that just talking about things will make it better. It's not waving a magic wand. It does make things somewhat better. You can share the load somewhat with other people. It doesn't fix everything, but it is an important part of learning how to cope with difficult times.
Okay. We see another question. What are some of the major signs to look out for in regard to a decline in mental health or a cry for help in sickle cell patients and or caregivers?
Well, I think with one of the big things, particularly with adolescents, is depression, particularly in sickle cell disease. And there's a whole bunch of reasons for that. And so one of the big things that we look for when kids are depressed, teenage years can be rough. And so it's actually not as much about the child having difficult times where maybe they're feeling sad and stressed, but it's when they feel that way and they're not also having times where they're feeling happy and having fun. And so if you talk to like the big fancy depression researchers, they'll tell you that actually depression is a lot more about not feeling good than it is about feeling bad. And so, one of the things that I look for, the difference between just struggling with typical stressors and a kid who's depressed is often the clinically depressed is the child who's not experiencing any joy, any fun. Sometimes you'll talk with them and they can't even imagine, like they can't even describe anything that would be fun to do. Even if they had a magic wand and could do anything they wanted to do. And so that's one of the big things that I think is a difference between a kid who's maybe struggling to cope with some stuff, but they're still hanging in there in terms of it not going into like a full, what we think of as a clinical depression, versus the kid that just really gets demoralized. And it's not just that they're feeling bad a lot of the time, it's that they're not feeling good. And so again, I work with kids who are struggling a lot of the time, but then they also can have times where they can laugh and have fun and do things they enjoy. It doesn't mean the child doesn't need some help in managing things, but that's usually less indicative of what we consider like a clinically significant depression, where you might need some more professional guidance. There's all kinds of different ways of working with kids to get them out of a depression. You mentioned medication, which can work, but there's a lot of other strategies that we do behaviorally, just getting people more engaged in life, changing some of the ways they're thinking that may be unhelpful. There are things people do when they're depressed where pretty much no matter what happens, the glass is not half empty, it's completely empty. And figuring out how they can kind of refocus some of that negativity. And for example, I mentioned gratitude and thankfulness, that's one of the things that's very notable. People who are clinically depressed can't think of anything in their life that they're thankful for. It's very common. Right. But their life objectively may have things that they could be thankful for. It has to do, when it gets to be clinical depression, there's this that distorts the world and makes it very painful for them.
Okay. And there's in the comment by Cynthia, I love this holistic and practical approach to treating the whole child. It's important, and the research is critical. So that's absolutely correct, Cynthia. Dr. Jeff, I know, there are issues we deal with raising a chronically ill child prior to COVID coming into place. Can you identify the extra challenges that you've observed that has occurred during this time period, this past year or so?
Oh boy, there've been a whole slew of things. I mean, I think, it's been sort of a mess for everybody, but if you're already in a very kind of challenging family situation, it makes it even worse. So, I mean, I think there's been this notion that we can just do things online and it's going to be the same as doing things in person. And I think most of us have learned that there are things we can do online that work pretty well, and there are things we can do online that don't work at all.
Right.
As well as they're supposed to. And so it's been interesting to me. I mean, I think I've talked with loads and loads of families over the last year about this at the hospital. I don't know if I could hazard a guess, but it's in the triple digits probably. And, I'd say about 10% of the kids say they do better with online school than they did in person. They don't like it socially. They'd rather be in school, but academically they've done better. And I think about half to 2/3 think it's worse. Now their grades technically might not be worse, but they don't feel like they're learning as much. They don't feel engaged. They not only are missing out on the social contact, but they don't feel like the quality of the education is as good, talking with the parents and the kids. And I think that's, again, not specific to sickle cell disease, but I think when you've got lots of other challenges going on, for example, I think it's been tricky to figure out. We have, with a chronic health condition, you have a lot of kids with accommodations and individual education plans and things like that. Some of the school districts, I think, did a really good job of being creative and figuring out how to help kids with special needs. But most of them, I think, did not, from the conversations I've had. So, you can't help a kid with physical therapy over a webcam, and things. I guess maybe some places did figure it out, but I think there are a lot of services that kids were getting in the schools that they just couldn't replicate them at home.
Right.
And of course, and then the other thing is just how it stretched parents, hearing about families where they've got 3 or 4 kids at home and you've got a 4-year-old and a 7-year-old and a 12-year-old, and they're all kind of doing different things and trying to coexist. And you just can't have everybody online, paying attention the way they're supposed to. I think that's just often it was kind of developmentally inappropriate to think that like a 2nd grade kid could just sit in front of a computer for 5 or 6 hours and follow along and learn lessons. So it's now the one thing I have heard, but I don't know for sure what's going to happen, is that there's supposed to be a boatload of money coming down from the federal government that was earmarked for the schools to come up with programs and initiatives to try to help kids make up for what's happened over this last year. So I'm kind of holding my breath and waiting to see what schools are going to do with that money and how they might help some of the kids that have been impacted over this last year. But I think, again, the quality of the education has not been particularly good. Kids with special needs in particular have kind of been left out. And a lot of those needs have fallen back on the parents. And, so some parents are super parents, but most people are not trained how to be teachers or special education teachers or speech therapists. And to just have that thrown on you when you've got all these other COVID things going on is it's pretty unfair, but it's what happened.
Right. And I think I have one more question. And it's kind of personal, but I do know my son has mentioned that playing video games, and I don't really have all the technical words correct of how to describe it, but he's able to communicate with his friends while playing. But he says that's part of a distraction for him, especially, if he's feeling bad or, miss his friends during COVID. That's been his go-to. What are your thoughts on that?
Well, I think, first of all, the way most people play video games now is not the same as when I played video games as a kid. Like when I played video games as a kid, it was kind of me in front of a computer with a controller going like this, and it was pretty solitary. And there are some people that still do things that way, but a lot of the online gaming is much more interactive. It is more social in nature. And so I think from the standpoint of doing something that's at least somewhat social, doing something that's a kid enjoys and is just doing it for fun, and if it's mentally engaging, it is distracting. So it can help if they're trying to distract themselves from maybe some mild pain or something like that. So there are a lot of things that can be good about it. That the problem to me with video games of different sorts is just thinking more about what's the big picture in terms of all the different activities that a kid is doing in the day. And so you see situations where a child is spending a massive amount of time playing a game that's not really very socially interactive. It's kind of repetitive. After a while, it may not be mentally engaging. It may just be sort of like mindless button punching. And so I think one of the things that we talk about when we talk about things like distraction and is this activity good for you or not good for you, is that it's hard to be just prescriptive and you say you do this and it's good and you do this and it's bad. There are people that have like a behavioral addiction to things that we normally think of as good. There's people that are addicted to exercise and they run until their joints get destroyed, so you can overdo anything. And so that's the main thing to me is I'm a big believer, if you look at the health literature, that there's lots of things that can be good for you in moderation. But just because something's good in moderation doesn't mean that you should do it 8 hours a day. So okay. He's probably a little bit right, but I think, again, it's kind of the nature of it, because some of the video games are, it depends on what you're trying to do as a parent. Some of the video games may be kind of hyper competitive. Sometimes the social interaction may not be as positive as you might like it to be. But I've also seen a lot of people do online gaming, including I have a 14-year-old son, and it can be a pretty positive thing. Just like people used to talk about how watching TV was supposed to be like a terrible thing to spend a lot of time doing. But when people watch TV as a family and would sit and talk about the programs, it could actually be a positive thing. It's just if the kid is sitting alone in a room, just mindlessly watching TV by themselves, it was not necessarily a good thing to do for hours at a time. So that's my take on it. I don't know if you think that I was dodging the question or not.
Oh, no, you weren't. And I know it's some monitoring involved with that, and making sure the timing isn't too long. But that's good. That's all of the questions that I have. I want to going to check real quick to make sure there aren't any questions on social media. So let me double check. I think they've all popped up across the screen, so we may have caught all of the questions that came out.
One thing I will just mention that happened a few years ago is that the American Academy of Pediatrics recommended that all kids should get depression screening once a year. and it's done through a lot of primary care pediatricians will do it through their offices. We've implemented that as part of our teen screening that we do with people. And just to be aware of that, one of the things that will happen sometimes is people will be asked whether or not they want to do that as part of a visit, like at primary care pediatricians' offices and things like that. Again, my suggestion in terms of mental health care is to say yes to those screenings. They're not an end-all be-all, but I think that's the spirit of a lot of the direction we're going with mental health care, is to make these things just part of routine health care. But occasionally you'll have parents that kind of question that because they're not sure it's something new and they don't know why it's happening. So that's kind of the new trend. So, again, I'm not saying you should say yes to something you're uncomfortable with, but just to understand that kind of routine check-ins about these things is the main direction we're going with healthcare.
Okay. Well, Dr. Jeff, we appreciate you taking the time to chat with us on this Tuesday evening about a very, very important topic. Is there anything you wish to share in closing comments or?
I mean, 40 minutes goes fast. I know maybe for you guys it was a long time, but for me it went super fast.
Okay.
Again, I'm not sure what the geographic spread of the people are that follow this broadcast. So I'm a faculty member at USC. So if you want to email me, it's my last name, which is up there, SCHATZ, and then the @ sign, and I'm at .sc.edu. So Schatz at sc.edu. I'm happy to try to field questions if there's things we didn't get to. If you want to send me an email. If you're somebody that gets your health care at Prisma Health in the Midlands, we have psychology people there. Anytime you're in the clinic, if you want to just say hey to one of us, we're around. We'll probably be catching you at some point for a routine screening. But just to let you know that we're around, we're part of the clinic team. We're available to check in about questions, small and large.
Okay. And Dr. Jeff, can you just say your email address one more time I'll make sure I add it to the comments.
Yes, you can get to me with the email. It's my last name, SCHATZ at SC for South Carolina .edu for education. So Schatz at sc.edu.
All right. So again, thank you, Dr. Jeff. And thank you to everybody who's listening in. If you're listening in on replay, thank you. And if you have any questions, you can email Dr. Jeff. You can put it in the comments and we'll get those questions to Dr. Jeff for answers. And again, join us on the 25th for our next Be Strong Tuesday chat. And we will see you then. Good night, everybody.
Thank you.